Washington Journal continues.
We're back with Max Richtman, who heads up the National Committee to Preserve Social Security and Medicare, talking about the debate happening here in Washington as part of the debt talks over whether to include Medicare cuts. I want to focus on that. That was the headline in the New York Times yesterday's paper. Administration offers health care cuts as part of budget negotiation. It says that the administration officials are offering to cut tens of billions of dollars from Medicare and Medicaid. What is your response to that? It looks like that the negotiators say the money can be taken from health care providers like hospitals and nursing homes without directly imposing new costs on needy beneficiaries or radically restructuring either program.
Well, thank you for inviting me this morning. I think it's important that beneficiaries are not hit again with out-of-pocket costs. We'll have to see where those cuts are and how they impact beneficiaries and how they impact providers. Let's not forget that cuts to providers, if they're too deep, will have a clear impact on access to health care for Medicare beneficiaries. So we're very interested in where these cuts are and how large they are, and we'll see what our response is.
What is the limit in your, from your opinion? How much can be cut before you say we're not going to support that?
I don't have a number for you. I do know that many of the town meetings we've been having around the country, we're hearing more and more doctors say that they will no longer accept Medicare patients because the reimbursement is so low. If it's cut further, I think it would have a dramatic impact. One thing I think that is very important that we've been trying to communicate to the White House is it's just been a little over a year when the health reform bill was signed into law. $500 billion was saved out of the Medicare program. I think it would be better to wait and see how these savings impact beneficiaries, how they impact providers. We've only been operating under this new law for a little over a year, and a lot of the provisions, the cost-saving provisions, haven't kicked in. So now, a year later, before many of these savings have been realized, we're talking again about cutting Medicare. I really think that's premature.
What about, though, if you look at what accompanied that New York Times story was this chart, federal spending on Medicare and Medicaid. And it shows the growth of federal spending on both of those programs. The darker is Medicaid, the light green is Medicare. You can see it going up and up. And then you take a look at federal spending in fiscal 2010 on Medicare and Medicaid, about $793 billion. It made up 23% of the federal budget. People point to that and say something has to be done.
Well, no question, something has to be done. But that something is not squeezing more out of Medicare and Medicaid. That something is dealing with health care costs across the board. Because just addressing these programs is not going to help reduce health care costs for our society, our greater society. And
why not?
Because they're going to be shifted to someone else. They're going to be, if a hospital is required to take an emergency patient. After that, if the reimbursement rates are cut to the point that the hospital is losing money, many of them are already losing money, that patient is going to be told, you've got to leave now. Maybe you'll go to a public hospital. Who pays for that? We all do. So really the answer is, I think, is to look at the cost of health care across the board, not just squeezing more and more out of these programs. Let's not forget, these programs, Medicaid, for our most vulnerable citizens, Medicare, you know, a lot of seniors, a third of seniors rely on Social Security. That's their entire income. 2/3, it's half their income. There's not a lot of room to come up with additional resources to pay more out-of-pocket costs for health care.
Would your group support any cuts to Medicare as part of these negotiations over the debt
ceiling? You know, we
ceiling?
supported the Affordable Care Act. It saved $500 billion over a period of time for Medicare. We supported that. So obviously, we're willing to look at the process and support what we feel is in the best interest, not just of our members, but seniors around the country and families. Families have got a stake in these programs, Social Security and Medicare. So we did support it. We're on record as supporting it. What I'm trying to get across this morning, and have been for a few weeks or months now, is let's see what the Affordable Care Act, which saved $500 billion, a pretty big number, what the results are. And as I mentioned at the beginning of the program, many of the cost-saving provisions have not even begun, haven't kicked in yet. So to me, it's premature to go back at Medicare and try to squeeze more and more money. But as I said, we're very interested in the numbers, how it's the process for reducing payments, reimbursement to providers, and we'll see whether we support the deal.
The President's Bipartisan Deficit Commission looked at that health care law but said we need to do more and offered some more suggestions for reforming Medicare to save money down the road. Does your group like what Erskine Bowles put forward?
Well, most of the things that were put forward we opposed, frankly, both in Medicare and in Social Security. There are ways to save money in Medicare that I think are more acceptable to the American public, certainly to our organization. In the prescription drug law that was passed in 2003, the federal government, Medicare, is specifically prohibited from negotiating with the drug companies for the best price for Medicare, unlike the VA. Why not do that? Why not save an enormous amount of money? It's only logical that an entity representing nearly 40 million people will negotiate. But the deal then was no negotiations, and I think there's a lot of savings that could be made. There are savings, I think, that are reasonable in improving electronic records keeping. I think that would not only save money, but it probably save lives.
But do any of those go far enough?
I think we need to see what the Affordable Care Act provides in terms of savings. And I think we need, negotiating prescription drugs goes very far. I mean, I've heard numbers of hundreds of $1 billion over 10 or 12 years. There are low-income seniors who do not qualify for Medicaid, but they're low income to the point where Medicaid pays for some of their out-of-pocket Medicare costs. Those, why not let those, at least that group of people, start out? They're called dual eligibles. Why not start out letting prescription drugs for that group be negotiated and save money there, save money from the Medicaid program? I think there are some steps that can be taken and should be taken before we squeeze every penny we can out of beneficiaries and providers. I think it's important to make sure that these providers will provide health care, and they won't if their reimbursements are cut time and time again.
All right. Phone calls lighting up for you. Lee is a Republican in Strasburg, Pennsylvania. Go ahead, Lee.
Yeah, I want to know why whoever votes for this, why their name can't be posted, who vote for it, and plus, why can't their benefits be cut? They want to cut everybody else's.
Voting for what, Lee?
It doesn't matter. For Medicaid and Social Security, it doesn't matter. There's nothing but a bunch of fees and they're a joke of life.